Today I would like to speak about antenatal care or prenatal care, which is actually a preventive health care for the pregnant woman and their unborn child. You might question me, why do pregnant women need a preventive health care? I would just like to state that WHO has given us the statistics that as of 2015, 830 women died during pregnancy or childbirth, and only 5 of them are in the high income group and the rest of them are in the low income group. So, the purpose of the antenatal care is to provide the opportunity to the doctors and midwives to improve the health care and of the pregnant woman and reduce the morbidity and mortality in both the mother and the unborn child. Taking the medical history from the pregnant mother is very important in order to pick up the problems that she might face during the course of the pregnancy, and family history and personal history also is very important in picking up problems during pregnancy. Doing obstetric ultrasound is as important as the medical history or examination in order to check on the fetal health, as well as in diagnosing certain conditions like preeclampsia in the mother. Obstetric ultrasounds are done on diagnosis of pregnancy in order to know whether it is located in the ideal place, that is within the uterus, and to rule out ectopic tubal pregnancies, that it is a healthy fetus and no chances of any miscarriages or infections are present. The examination of the patient involves taking her height, weight, BMI, temperature, blood pressure and pulse rate, and examination of the baby physically. The blood test involves looking after her complete blood count in order to rule out anemia and other blood disorders, checking on her blood sugars to know that whether she is diabetic or not, or prone to get a diabetes during pregnancy. And blood group and RH typing is very important to know that there is no RH incompatibility, and certain blood tests are done to rule out infections in the mother which she can pass on to the baby, like blood VDRL, hepatitis panel, HIV, and these are treatable conditions, and we can treat the baby too antenatally before these infections do any harm to the baby. The ultrasounds need to be done in 4 occasions. The first will be done on diagnosis of pregnancy to make sure that it is located in the right place, which is inside the uterus and not outside the uterus like the tubal ectopic pregnancy, and also to know whether there is the baby is going to be miscarried or if there is any vesicular or molar pregnancy. And the second scan is done between 11 and 14 weeks. This is mainly to rule out any chromosomal anomalies like Down syndrome or what we call the Mongol baby, or other trisomies which are life-threatening conditions for the baby. And the third ultrasound is being done between 18 and 20 weeks, which will diagnose the structural defects in the baby. It is the parent's choice whether to continue with these incompatible life-threatening conditions or not. And the last ultrasound is the growth scan in order for us to know that the baby is growing properly and is not afflicted with the condition what is called the intrauterine growth restriction, or a macrosomic baby which is too big, which can happen due to diabetes in pregnancy. We have an excellent fetal medicine specialist department who do take care of the fetal health right from the time it is conceived till birth, and they can manage all the health problems in the fetus even before it is born. I am Dr. Lakshmi Aswathaman, a clinical lead and a senior consultant in the Department of Obstetrics and Gynaecology at MGM Healthcare. I would just like to give 5 small tips for all expectant mothers. The first one is to improve your healthy lifestyle, which is going to benefit you, your baby and the family. The second tip would be, don't be afraid to ask questions to your care provider, be it obstetrician or the midwife or the nurses assisting in the outpatient department. The third and the most important tip would be to develop a personal relationship with your unborn child. Spend at least 2 hours with the baby to talk to the little one. The baby listens to your voice. It gets very much used to your voice. Use pleasant words while talking to the little one or to your partner or to the family. It senses all your feelings, feeling of happiness or anger. So please do not get angry or give in to the mood changes during pregnancy. Baby senses everything. The fourth tip would be, please do take the prenatal care seriously. Important steps are taken by the obstetrician as well as the midwife to optimize your health care during pregnancy. The last tip is, I would recommend you and your partner and family to go through pregnancy happily and fearlessly. Pregnancy is a physiological event and it's a natural event in life, and I would just recommend you to go through it fearlessly. And we at Varam would like to make it as pleasurable as possible.